important definitions. We have something called bloodstream infection, which is nothing but a true infection with pathogen in the blood, because you have to exclude something called a pseudobacteremia. So this is nothing but septicemia as well. Then we have a definition for CLABSI, that is called central line associated bloodstream infection. So which is nothing but a bloodstream infection with central venous catheter in place, and that is occurring within 48 hours without any alternative source. Without any alternative source. So that is what we call CLABSI. And there is another term called CRBSI, that is called as catheter-related bloodstream infection or central line related bloodstream infection. So here the definitions are going to be very stringent, because we are confirming that the source of infection is catheter. CLABSI is more of an empirical diagnosis, where you're not 100% sure that the catheter is the reason for infection. We are just assuming that catheter is the reason for infection. But in CRBSI, we are establishing the source of infection as the catheter. For that 100%, you have to have quantitative cultures. We should see what is the load of organism in the blood. And we see something called as differential time to positivity. That's called DTP. How fast the reports are tending to be positive. All those things are going to tell you that catheter is the source of infection that you're seeing in the blood. So this is a very stringent criteria. That's why we don't really use it in practice. It's not practical. We stick on to the term called CLABSI, where we believe that central venous catheter is the reason for patient's bacteremia, and we assume it to be the case, and we start antibiotics accordingly. So in common practice, we are going to use the term called as CLABSI. So where patient is having a bloodstream infection with CVC in place. That's it. We don't know for sure whether CVC is the reason for this infection or not, but we assume that CVC to be the source of infection. So it's called CLABSI. And finally, we have sepsis. We have already discussed in the fever and sepsis chapter. It is nothing but severe infection leading to organ dysfunction, typically a Q-SOFA score of more than or equal to 2 with a dysregulated host response. So this is what we call sepsis. And that the CLABSI definition, I feel, is going to be the most important.